Ever wonder why some eyes after surgery look so natural, yet some cases look so strange and so clearly done, and many times they lose their entire identity? The eyes are literally the most sensitive part of the entire facial rejuvenation structure and surgeries, and if you get it wrong, the whole face looks literally off. Hi everyone, I'm Dr. Karam. I'm a board-certified facial plastic surgeon. I'm also the founder and creator of Karam MD Skin. And today we're gonna talk about eye rejuvenation my way, the way that has given me 20 years worth of sustained and reproducibly natural, refreshed looking eyes without looking done. Everyone who's interested in getting their eyes done is gonna wanna watch this video all the way through. Whether you have surgery with me or somebody else, you're gonna wanna take this information with you and make sure you're empowered to do the right thing so that you can look beautifully refreshed and not look like you've had your eyes done. Here we go. So the eyes are central to our identity. That's what we look when we look at each other, right? We're looking at this area, the periorbital regions. We're taught to look into each other's eyes when we speak, make eye contact, etc. What's interesting psychologically and sociologically is we somehow trust people in terms of work-related things, in terms of just aptitude, etc., and tons of studies that have been done on this aspect that when somebody looks youthful and not tired, we feel that they're capable of doing a better job, etc. At the end of the day, aging makes us look very different than the way we feel. We might have gotten a great night of sleep, we might have gotten an amazing day of rest, but yet our eyes tell a different story, and the impression that it makes often leaves us in a condition where we feel there's a gap between the way we look and we feel. This is what we talk about all the time, about looking as young as you feel. And the eyes are often a very important part of creating that gap between those two. It is an important area to target, and it's obviously a reason why there are so many people interested in eye rejuvenation surgery. But at the same time, many people are scared, and naturally so, because they've seen so many results that leave them worried that what if that happens to them? They look different, eyes are stretched, eyes can't close, a number of different complications that we see with that. And when the eyes are naturally rejuvenated, nothing jumps out. It literally looks like any other person. They just don't look tired. There's no hollows, there's no bags, there's no hooding. And at the end, that person looks refreshed. I had a patient, he was in his 20s, he was a linebacker for an NFL football team, came in to see me for consultation, had bags under his eyes and hollows. And what his reason for this was that the coaches felt that he was burning the midnight candle on both ends, partying all night, etc. And that's why his eyes looked so tired. And as reality had it, this guy was working his butt off to make the team and doing everything right, eating right, sleeping right, etc. Yet his eyes gave a different impression. And he was worried that the coaches are basically going to interpret that as something reflecting his lifestyle. And he wanted to stay on the team, etc. So he came in and basically had upper and lower blepharoplasty with a fat transfer. And sure enough, his eyes look incredibly rested and fundamentally how he felt. But his problem at that early age was related to genetics, whereas the majority of the people have this condition related to aging. And that's probably who you are if you're watching and listening to this. You're somewhere in your 30s, 40s, 50s, and starting to see some of these changes happen. And this is good information for you going forward. So what makes up the periorbital region? Well, basically, as I alluded to, it's the upper eyelid, it's the lower eyelid. Now, this are usually means that they have excess skin on the upper and lower eyelids. Sometimes you could have puffiness on the lower eyelids, but there's also other parts to it. There's the volume of these regions. The temporal region is included in the periorbital region. So excessive hollowness in the temporal area can make you look tired. Hollowness around the lower eyelids, hollowness around the upper eyelids, hollowness in the upper eyelid cheek junction. This can all lead to a more tired look, aged look, and as a result, all of those areas need to be evaluated simultaneously. So as you can see here in this example, this is what youth looks like. There's fullness in the upper eyelids, there's fullness in the lower eyelid region, the temples are full. There's very little to no excess skin in the upper eyelid or lower eyelid. The contours look really good. And a very important part is now when we look at what aging looks like, now you can see there's hollowness in the upper eyelid and lower eyelid region, hollowness in the temporal area. So these are all areas that lose volume, but there's excess skin in the upper lids and lower lids, leading to this eyelid cheek junction. And what happens during youth, if you look at this on the profile and you look at the distance between the eyelid and the cheek, it's very short in youth. And what happens with age is it elongates. This elongated eyelid cheek junction is an important structural change that happens with age, and that is resultant of both loss of volume around this area, but also elongation of excess skin. So this combination of things that are happening leads to true structural changes around the eyes. And that is something that is, I say, foundational to reversing the steps. And this is key. If you want to look like you used to, you need to simply reverse the steps that got you there in the first place. So it makes perfect sense to look at all of these areas together and reverse the steps that led to the aging process. Let's look at this carefully again. Volume loss in all these regions. Upper eyelid skin excess. But here's a nuance. There's a portion of the upper eyelid which is continuous with the corner of the brow. This corner of the brow is something that descends with age. It actually comes down a little bit. So this descent of the corner of the brow or lateral brow leads to hooding of the upper eyelid in addition to having extra skin up there. And it's a common misconception to think that that's all related to upper eyelid skin. So included in this periorbital evaluation is the lateral brow region. Now, let's look at what happens to the lower lid. Lower lid skin becomes excessive as it becomes longer. That is something that's cleaned up by shortening that distance. However, there's also, in many cases, going to be some excess fat in there. This is called pseudoherniation of orbital fat. That's what leads to bags or puffiness under the lower eyelids. Not everyone gets this. Now, keep that in mind. Not everyone gets bags under their eyes, but almost everyone has excess skin. But it's important to diagnose which one of these conditions are there, because as you'll see, the surgery associated with it are different. So here is an example of a case where I rejuvenated the periorbital region using a combination of upper eyelid blepharoplasty, lower eyelid blepharoplasty, periorbital fat transfer, and lateral brow lift, which in this case was associated with the vertical restore. But as you can see, this whole area looks globally rejuvenated. The eyelid cheek junction became significantly shorter. So let me share with you an overview of my overall philosophy, and this has been my philosophy for 20 years. As I said earlier, when we look at one another, we're looking at the periorbital region. We're not looking at the upper eyelid. We're not looking at the lower eyelid. And a very common mistake is surgeons and patients focus on a specific part of that periorbital region. So they look at the upper lids and say, oh, my upper lids are hooded, therefore I need to go get an upper blepharoplasty, and completely forget or lose sight of all the other components, which I'm going to share with you in a moment, what those components are. And as a result, they go get that, and then there's a mismatch. There's a disharmony, an imbalance, because no one has a young-looking upper lid with a aged-looking lower lid, or vice versa, or this combination of changes that affect that region usually are happening simultaneously. So bottom line is, this entire area called the periorbital region needs to be looked at carefully, and the procedures that would benefit that region need to be addressed collectively. This is a key. So let's talk about my rejuvenation protocol. First step is diagnosis. I look through mental checklists of all these things that are happening to the periorbital region. I make a note which ones are involved. If anything is involved in the aging process, it is communicated with the patient at consultation. This is something that you should consider doing. One area that I will not compromise is that I never do eye rejuvenation without fat transfer. So if I ever do a lower eyelid blepharoplasty or a skin pinch, I'm going to do a fat transfer in association with that, because simply cannot get a beautiful, youthful, refreshed look without the fat transfer. Volume is extremely important here. So what are the procedures that we're looking at? The named procedures are upper blepharoplasty to remove excess skin. Lower blepharoplasty, in my practice, the nomenclature includes the removal of fat pads on the inside of the eyelid using a transconjunctival lower eyelid blepharoplasty, and then I come out to the outside of the eyelid and I do a skin pinch. That's when I do a full lower blepharoplasty. In cases where somebody doesn't have fat pads, I just do a skin pinch. A lower eyelid skin pinch is where I literally just remove the excess skin on the lower eyelid. Now, if the lateral brow is involved, either they would get a lateral brow lift in conjunction with the surgery, or if they're getting a vertical restore, which in my practice is most commonly done together, the lateral brow lift is done as part of the vertical restore. Otherwise, they get it as an isolated procedure if there's hooding related to the lateral brow. Let's take a look at how this all looks when it's brought together. And as you can see, there is literally no difference in the shape of the eye, the position of the eye, the look of the eye between before and afters, except for the fact that they don't look as tired and they look rejuvenated. And that's by addressing all of these things simultaneously in every single case. Now, there are exceptions. There are exceptions in cases where somebody doesn't look like they have that much upper eyelid skin, they don't get an upper blepharoplasty. If they don't have, hooding of the lateral brow, they don't get a lateral brow lift. So this customizable, but everything gets evaluated, and that's the key. Too many times what we see is people will go in and get just one part done, not the other, and that's where things look off or they don't look fully rejuvenated. Now let's talk about some common pitfalls, some mistakes that people make. And we see this exhibited in Hollywood, unfortunately, a lot. And these are the cases, because they're so popular and people see them all the time, they're what leads to people to be scared of them, and rightfully so. So one of the things that can lead to an unwanted outcome of these types of surgeries is if somebody takes out too much skin. Common mistake, tale as old as time. Too much upper eyelid skin or too much lower eyelid skin can be removed as part of these procedures. If it's too much skin removed, the eyes can't shut, the eyes are open, you get dry eye syndrome, there's all sorts of problems associated with that, corneal abrasions, etc. Too much skin is removed, the lower eyelid can pull down and have malpositioning, that looks terrible, again leading to dry eyes, etc. I don't believe in commonly doing canthopexes or canthoplasties, which is where you tighten up this lower eyelid, as part of a standard blepharoplasty. A lot of surgeons do this for some reason, but that also leads to a more slanted lower eyelid or overall changes the shape of the eye, leaves the person looking like they've had work done. I'm not a fan because it changes the identity. For me, everything should look the same as it did when they were younger. All we're trying to do is reverse the pattern of aging. And as I mentioned, incomplete outcomes can really tell that something has been done. When there's hooding of the lateral brow, all the skin, for example, is removed from the lower eyelids and no volume has been added, and somebody gets one single procedure and there's all these other components that are aging, it just looks off. It looks different, and therefore in a second you can tell something's been done, which is not the goal of these procedures. It's not your goal, I'm sure. So once again, when you look at these results, you see just how soft and natural and inconspicuous the final outcome is. The point of all of this is to restore you back to where you were, not to change you, and not to lead you looking like somebody who's had surgery done, etc., not to change your identity. So what are some guardrails that you can put in place to prevent yourself from going down this direction? So number one, treat the entire periorbital unit when it's applicable. Definitely want to get everything done when it's needed for the reasons I just mentioned. Harmony, balance, and cohesiveness are very important. It's equally as important that the technical ability of the surgeon to do the procedures well, to do it right, not take too much, not take too little, leave everything looking balanced. The combination is key to this whole thing. If you are going to err on the side of not taking too much. It's always more normal and natural to have a little excess than it is to have too much taken. Once in a while, I'll get a patient who've done a beautiful job at rejuvenating their eyes, come back and say, hey, Dr. Karam, can you take a little bit more skin? There's a tiny bit more skin here. My answer to that is, sure, we could take it, but we're risking taking too much. And if we do that, we're gonna ruin your life forever. Not a good idea. Be very, very grateful that you get through your eyelid surgery, look normal and natural, and can have full function of your eyes without having any impairment. A little bit of excess is totally fine. It's a good side of the fence to land on. When it comes to fat transfer, it is imperative you don't overfill that area, because overfilling is completely unnatural and abnormal. When you look at young people in general, you just see eyes that are pretty much slightly underfilled as their baseline. No one is overfilled. And trying to get fat transfer or filler to be, exactly filled to the brim is a recipe for disaster. All of my fat transfers by definition are slightly underfilled because that is the normal look of a lower eyelid. And think restore, not reinvent. We're not trying to make you look like a different person. Stay away from fad procedures, foxtail, cat eyes, this, that, canthopexes, etc. Stick with the basis, stick with the fundamentals. One of the reasons why I don't need to do canthopexes and canthoplasties for my lower eyelids is obviously Number one, I don't take too much skin. Number two, I augment this area with fat transfer, which helps support the lower lid and keeps the lower lid from drifting downward. That's a very, very important part of safety. That's another reason why I don't do lower eyelids without fat transfer. All right, my friends, I hope this gives you some good idea of how to navigate this. Obviously, if you want me to do your eye rejuvenation procedures, I'm more than happy to. Head to our website and submit a consultation. If you go with anyone else, at least this gives you some parameters, some ideas of how you can do this safely and get the results you're looking for, because it is possible. You don't need to be scared, but you need to be cautious. Approach this thing with an educated and empowered mind that you can help navigate with the surgeon or listen to what they have to say to you in consultation, and then have something to return that idea. All right, thank you so much. Follow along and subscribe to the channel. Hit like if you enjoyed it. Any comments or questions you have, drop them below. I'll be more than happy to answer. Thanks so much, Dr. Amir Karam.